Antibiotics are vital for battling bacteria, but if you use too much, you can have some serious problems.
And this morning, we take a closer look at an infection that can actually be deadly. At the Cleveland Clinic in Weston, infectious disease specialist Dr. Giorgio Tarquini is seeing a growing number of cases of a bacterial infection. It's called Clostridium difficile, or C-diff.
Usually it happens because patients have taken antibiotics before that killed off the good bacteria, and this takes over and starts multiplying and causing disease in the colon.
Dr. Tarquini says C. diff produces toxins that attack the lining of the intestine. The hardy spores can survive for weeks or even months and can easily be spread through contact with an infected surface or person. Symptoms of C. diff infection include diarrhea, severe abdominal pain, nausea, and fever. Left untreated, Dr. Tarquini says C. diff can lead to hospitalization in the intensive care unit.
The worst case scenario would be possibly surgery to have to remove the colon if the colon is so diseased that it cannot be saved. And other times this can lead also to death.
Treatment for C. diff involves the use of 2 specific antibiotics depending on the severity of the condition. Patients are also given probiotic therapy to support healthy bacteria and hopefully prevent recurring infections. Those at greatest risk for C. diff include people who've recently completed a course of broad-spectrum antibiotics, patients in hospitals or nursing homes, people who've had a weakened immune system, anyone over the age of 65, and those who've recently undergone abdominal surgery.
I think the most important thing is to realize that antibiotics are overprescribed. You shouldn't take antibiotics for a common cold, for example. And another thing that is helpful is taking the influenza vaccination every year.
And getting the flu vaccine also reduces the risk of other infections that could require antibiotic therapy too. According to the Centers for Disease Control and Prevention, an aggressive new strain of this C. diff is affecting people who have never taken antibiotics at all. And that new strain is blamed for several outbreaks in just the past couple of years.